Good evening, folks. My guest for tonight is a world-renowned Canadian nephrologist. He completed his medical degree from the University of Toronto and his residency and fellowship in nephrology from the University of California. He has his own clinic in Toronto, and he's the author of a book, Diabetes Code, Cancer Code, and a complete guide to intermittent fasting. Jason, it's a pleasure as ever to have you. So you are a nephrologist, and you were a very conventional doctor, if I'm not mistaken. So what made you to move from, despite being a nephrologist, what made you to move from point A to point B, where you started to advocate low carb, high fat diet or intermittent fasting?
Well, I think it's because a lot of what I saw in terms of diabetes was not really getting any better with sort of conventional treatment. It was just getting worse, if anything, and we weren't doing anything about it. And really, a lot of what we are sort of taught made very little sense. I mean, even if you think about it, we have glycemic index, for example, and we know that a lot of carbohydrates, especially the highly refined carbohydrates, they don't they spike the glucose more than, say, eggs or meat or fish or whatever. So if we know that those the blood glucose is getting spiked up by these carbohydrates, why would we ask diabetics to eat more of those, right? It doesn't make any sense whatsoever, like just purely from a logical standpoint. And if you think about it, too, the whole idea of using low carbohydrate diet is simply to say that certain foods will raise your glucose more than others. So if your blood glucose is high, then eat less of the foods that make your glucose go up, which again is very, very logical. And now, of course, so that's where I started to think about it. Same thing with intermittent fasting. Again, not a very difficult concept. If your body has the ability to store calories, which is just food energy, which is in the form of glucose and in the form of body fat. So if you don't eat, your body's going to take the calories that it needs from your glucose because it's got to burn the glucose. If you're not eating, it's got to use something for energy for your metabolic rate. So therefore, it's going to burn the sugar, and that's good. If your body is using up the sugar, then you're going to be able to reduce your need for medications or lower your blood sugars, but completely naturally without any other medications. And in fact, when I started to use it in practice, the results I saw were simply sort of astounding. I mean, people were coming off their medications, they were, reversing the diabetes, their sugars were coming down, they're feeling better. So it really was a very interesting time because everything that, people were saying, we were being taught wasn't jiving. It wasn't, it didn't make any logical sense. And when I saw patients on it, it didn't work. So therefore, that's why I moved to other treatments that sort of made more sense. And then, of course, the science has sort of caught up. There's lots of data now looking at low carbohydrate diets and why they're so effective. That's why all the major associations like the Canadian Diabetes Association, the American Diabetes Association, they all endorse these low carb diets, and they're all starting to move around in terms of intermittent fasting as well.
So the next question is very interesting, Dr. Jason, as you are the man, and there's no better person than you to answer this question. Like you are a nephrologist, you know more about kidneys. So there is a mass hysteria, or I might say there is a misconception. A lot of people thinks that high protein diet causes kidney disease. So what do you think about this?
That's not true. I mean, we worried about that like 20 years ago, perhaps. And yeah, it's nothing. There's no data on it really whatsoever. It's if you have normal kidneys, eating a high protein diet doesn't lead to kidney disease. It's just one of these things where somebody thought at one point that perhaps, because of the nitrogenous waste products, that you're putting too much strain on the kidneys if you eat a lot of protein, and therefore it could be bad for you. So many years ago, this is probably 15, 20 years ago, people had recommended a very low protein diet for people with kidney disease. But then there's a very large study called the MDRD study, which was a randomized controlled trial looking at very low very low protein diets for kidney disease. And of course, it made no sense. It made no difference whatsoever. So we've gone back to actually telling people to eat more protein. So not low protein, but relatively high protein, because their nutritional status wasn't very good. They had very low albumin rates and so on. So even for people with kidney disease, many of them are actually being encouraged to eat more protein.
So here is a catch. The most common cause for kidney disease, if I'm not mistaken, it's hyperinsulinemia, hyperglycemia, or uncontrolled blood pressure for years and years. That's why we call them a diabetic nephropathy. So what do you think? What is the most common cause for kidney disease in the world?
The most common cause, really, by far, is diabetes, and most of diabetes is type 2 diabetes. Hypertension or high blood pressure, which is part of the metabolic syndrome as well, is also very, very important. So those two things can be impacted by nutrition, but by far and away, those are the two most important causes of kidney disease overall.
So if we can control their hyperglycemia, if we can control their blood pressure with low carb diet, we can even slow the progressions of diabetic nephropathy. For example, it takes 5 to 10 years a diabetic patient to develop microalbuminuria, or like where the kidney started to where we can see in the urine a very, very tiny amounts or little amount of albumin, which is a protein. And after 5 to 10 hours, we see proteinuria, or the macroalbuminuria. So when I see this two story, like from diabetic to microalbuminuria to the macroalbuminuria, so it's not the kidney, it's not the protein that damaging your kidney, but it's your uncontrolled blood pressure, your uncontrolled hyperglycemia or hyperinsulinemia. So why nobody talks about this? But we always talk about protein gonna kill your kidney, you damage your kidney. Sometimes it is
Yeah,
very
I'm not sure why. It's a very strange sort of thing. I mean, hyperinsulinemia is much, much more important. I mean, I think it's a lot of old thinking. So this protein idea was around 20 years ago, but it takes a long time for people to forget about it. So as a nephrologist, I'm in the field, so we forgot about all that high protein stuff sort of like 10 years ago, but in the general population who is not really following the debate so closely. In fact, like as I was saying, we tend to actually recommend a lot more protein these days, just because we see other problems, which is this thing called protein malnutrition. That is, people, as they develop kidney disease, actually start to get very low levels of protein. So that's why a lot of people now encourage people to take more protein. But that's, if you're not in this debate, then perhaps you still think about this sort of high protein as a bad thing, but it's not.
So if I'm not mistaken, Dr. Jason, I haven't found any single study that shows that low protein diet is good for your kidney whatsoever. The studies are so inconclusive. Like it doesn't matter you eat little protein or too much protein or you're not on protein, but low protein diet is not. It then shows that it's good for your kidney.
Yeah, there's no data. In fact, the MDRD is a randomized control trial, so it's much higher level of evidence than anything else that's available there. And that was a negative study. That is, a low protein diet does not protect your kidneys in any way. So it was a negative study, and it was fairly large. It was a multi-million, multi-center trial. So very high level evidence that lowering the amount of protein does not help your kidneys, but could lead to sort of this not enough protein deficiency that you see in kidney disease.
That's a protein malnutrition, or
Yeah, it's called protein malnutrition. We see very low albumin levels when people often, as they start dialysis or they're getting to dialysis, which is a bad prognostic sign. So now people are trying to get them to eat more protein.
so. So the next question is, Dr. Jason, what do you think about when somebody says low carb, high fat diet or an intermittent fasting is not scientific or is unscientific?
Again, the data is all starting to come out now. And there was a recent randomized control trial looking at intermittent fasting in diabetes, and they found they were able to reverse people's diabetes in about 50% of those cases, which is very, very high. And again, the idea behind intermittent fasting is not that difficult. If you don't eat, your body will burn down glucose because that's a source of energy, and it will burn down body fat. So if you lose weight, your diabetes gets better. As you lose weight, your kidneys get better. There's no debate about that. So therefore, why this sort of ancient sort of dietary strategy is not being embraced? There's no reason for that, other than people are scared of new things, I suppose.
So why do some skinny people do to have type 2 diabetes as well? So how do you explain that?
Yeah, so it's not just your weight. It's about the ectopic body fat. The other thing that we do see a lot of now these days is a lot of latent autoimmune diabetes, so-called LADA or LADA, and it's increasing for some unknown reason. And it's getting confused with type 2 diabetes very commonly, just because some people think, if you're older and you have diabetes, it must be type 2 diabetes. So one, there is more of this, more of a type 1 type diabetes, which is occurring in the older, middle age and older people. So a lot of it is not actually type 2. And then second is that there's a lot of so-called skinny people with diabetes, but they actually have a lot of abdominal fat. So this happens a lot in South Asians and East Asians. So the East Asians and South Asians, if you look at body mass index, are not obese, but they tend to be smaller, right? They tend maybe to be shorter than, say, Americans, or they tend to be less muscular. Their build is more smaller build. So therefore, those body mass index may indicate that they're normal weight, but they actually have, when you look at them, they do have the abdominal obesity, and that can lead to the metabolic syndrome and type 2 diabetes. So the weight is not a perfect, marker for these sorts of things.
So are you referring here like a TOFI, thin outside and fat inside?
Yeah, exactly. So some people can look very normal on the outside and still have a lot of fat on the inside. If you do an MRI, for example, you could see a lot of abdominal fat in some of these people, and even though they look skinny, they look good, you can still get it.
So what is your five like still there is a belief that a diabetic patient should not go on low carb diet or they should not do intermittent fasting.
I think that's a little bit, I don't agree with that. I actually think that there's incredible benefits to people with type 2 diabetes to go onto these diets because, as I said, it makes perfect sense why these diets should work. And the evidence that's coming out now shows that, in fact, that is true. They do work extremely well. I mean, not just well, but like ridiculously well. So Dr. David Unwin in the UK, he uses low carbohydrate diets, and he also gets a remission rate, so a drug-free remission rate of almost 50%. So, with intermittent fasting, with low carbohydrate diets, you can put people, 50% of the patients that we have don't have to have type 2 diabetes, which is an insanely high number of people that could benefit. So it's not just like a little bit good. It's like mind-blowingly good in people who do it.
So Dr. Jason, as you are a nephrologist, so what are the 5 tips would you give to the Asian people, especially like the people from Nepal, India, and China? Because as you said earlier, not all of them are obese. Like sometimes they're not as compared to Caucasians or European, but deep down, like we see, like when you do MRI or some other sort of test, we can see there are lots of belly fats or visceral fat. So especially people from these ethnic groups or Asian ethnic groups, what are the 5 things would you tell them to so they can slow their progressions of diabetic kidney disease?
I think, the first one would be to make sure that you're not snacking all the time. Because a lot of the snacks are, they're just every time you eat, your insulin is going to go up, your glucose is going to go up. So the less times you eat, the better. So this idea that you should eat 10 times a day or 8 times a day, it's not true. You should eat fewer times in a day, if anything. So so that's sort of time restricted eating or intermittent fasting. Number two is cutting down sugar. So that's pretty much everybody agrees with that. Added sugars with the fructose can cause a lot of things like fatty liver disease and so on. So cutting down the sugar is very good. Number three would be cutting down refined carbohydrates. So, carbohydrates are not intrinsically bad for you, but if you have type 2 diabetes, then your body is not handling those carbohydrates the way it should be. So you should probably eat less of them. As I said, some foods raise your blood sugars and some foods don't. So eat more of the foods that don't raise your blood sugars. It's really not that difficult to understand that. And then number four is don't be afraid of the fat because, in the past, again, and these ideas have, many of them have been proven wrong, but this idea that we need to eat a low fat diet, there's really no good evidence that suggests that is true in any way. So don't fear putting the fat in. The idea, again, that you should, avoid saturated fat too is controversial, but there's really little evidence to suggest that natural fats, so the fat that you might find in butter, for example, or meat, some of which is saturated, not all of it, but a lot of it is just not that bad for you. There's a lot of data on dairy fats, for example, that and dairy fat is a type of saturated fat that's actually quite healthy for you. So this idea, again, it was sort of an idea from the 70s. So probably about a 50-year-old idea, and it's just taken that amount of time to change, right? And then number five, just make sure you eat adequate protein. So protein is amino acids, and they're necessary to build muscle and other functional tissues. So make sure that you need eat adequate protein for your needs.
And I think you said you can connect with me here. If it is Asian people, like they think fruits is very healthy, but they're diabetic, they are uncontrolled hyperglycemia, and they all develop diabetic nephropathy, retinopathy, and still they believe that the fruit is very healthy for them. So what is your take on fruits for the diabetic patient?
Fruits are probably different than before. So if you look at the fruits you have today, they're probably quite different than the fruits I ate in the 70s. They're, more available, they're sweeter, they've been bred to be very sweet. So if it's sweet, of course, it has lots of fructose, which is not good for your diabetes. Compared to a lot of the fruits, if you think about, fruits in the 70s, one, they were not available most of the time. There's a very limited season for fruits. It's not like you had year-round availability, and there was the sweeter varieties were not available, and they all had seeds in them, right? So they weren't great to eat. So people didn't eat a lot of them. Whereas now you get fruits that are very sweet that you can get year-round. So they're sort of like they're almost like candy. They're so sweet. So therefore, lumping fruits and vegetables together makes very little sense, even though that's been the way it's been done. But vegetables are very different than fruits. I mean, they have a lot more fiber, for example, they aren't sweet, right? If you eat spinach, it's not particularly sweet compared to a cantaloupe, for example. So, they're very different from each other. So lumping them together, and that's where a lot of people in the United States and the UK, they're all like, eat your fruits and veggies, as if fruits are the same as veggies, but they're not. And the fruits these days are much different. Like getting kids to eat fruit is very easy these days because it's very sweet. Getting kids to eat fruit, 50 years ago was a chore because the fruits were, a bit sour and tough for the most part. So nobody really wanted to eat them. So eating fruits, this idea that you should eat more fruits is probably not correct. You have to look at it differently compared to vegetables. So vegetables like spinach or cabbage, or you probably eat as much as you want, really. Broccoli, you probably can't do yourself a lot of harm. But fruits, yes, you can if you eat too much.
Because a lot of people had this thinks that the fruit does not spike their blood glucose, because the fact is that the fructose from the fruits, they're not metabolized by the insulin. They goes directly to your liver, where they convert it into triglycerides. So at the end of the day, they wind up being a fatty liver, and which is one of the other reason for insulin resistance. And that's how their diabetes, in a long run, the diabetes will get worse and worse by the time. And so when they are taking fruits when they're taking fruits, they think, oh, the fruit does not spike my blood glucose.
Yeah, that's the problem with fruit. And one of the reasons people used to think fructose was very, very healthy for you because it, is the fruit sugar and all this sort of stuff. Um, the fructose molecule is really the same whether, table sugar, which everybody agrees you should eat less table sugar, which is sucrose, is a molecule of glucose and fructose. So everybody says, yes, that's a bad thing. It's probably worse for you than carbohydrates like starches, which are just glucose, right? So if you eat bread, so starches are amylopectin and amylose, and they're chains of glucose. So it's all glucose, like 100% glucose, whereas sucrose, table sugar, is one glucose and one fructose. And everybody knows you shouldn't eat too much sugar. So in essence, they're saying don't eat too much fructose. But then when it's 100% fructose, everybody seems to forget that it's the same fructose. The molecule is the exact same, whether you get it from a mango or you get it from table sugar. It's the same fructose. Or people say, well, you shouldn't eat too much of this high fructose corn syrup, which is something that we have, especially in the United States, which is a sweetener made of corn called high fructose corn syrup, which is 55% fructose and 45% glucose versus 50-50. That's not a huge difference between table sugar and high fructose corn syrup. But again, we say, okay, high fructose corn syrup, that's really bad for you. It's like, but the fructose is the exact same fructose that you get in fruit. Yes, you get fiber, you get vitamins, you get other things with it, but you get a lot of fructose too. So it's the same. So you got to remember, yeah, absolutely. The fructose doesn't spike your blood glucose, but it's still doing something very bad for you in the body.
So we're running out of time. So my last question to you: a lot of people thinks that going on low salt diet can improve your kidney disease, or going on low salt diet might help you to manage your blood pressure.
Yeah, the whole salt thing has been an interesting debate, I have to say, because the idea was that if you eat less salt, you'll have less hypertension, and that's not actually necessarily the case. And this was a big debate a few years ago. The Institute of Medicine in the United States had actually looked at the data. So if you eat less salt, you can actually lower your blood pressure like a little bit. It's not a lot. It's like maybe 3 millimeters of mercury. So if your blood pressure is 155 systolic, for example, by eating a very low salt diet, you might get it down to like 152, which is really very, very minor. However, if you look at hard endpoints, that is heart attacks and strokes and all that sort of thing, there was no benefit to eating a low salt diet. In fact, if anything, it looked like the opposite. It looked like eating a low salt diet was worse. And the reason is that if you eat a low salt diet or a very low salt diet, then other hormones get notched up. So this is just natural. So, if you get a little bit decreased ECF volume, extracellular volume, you might increase your beta agonist system. You may increase your ACE system, angiotensin
Converting into.
converting enzyme. And these are actually precisely the things that we block in heart disease. We use beta blockers, right? We use ACE inhibitors. So if you're ramping up the ACE system because you're salt depleted, which is a natural thing, right? That's what it's supposed to do. Well, then there's a trade-off. Yes, your blood pressure might be slightly lower, but you're ramping up all of these hormonal systems that actually can be detrimental in excess. So if you look at, and so a few years ago, like 10 years ago, there's a big sort of study on it, and they basically said there's really very little evidence that eating a low salt diet helps you in any way. So even from a kidney disease standpoint, the only time we restrict it is in end stage disease. So if you're on dialysis, if you have like very bad heart failure, for example, an end stage disease, then yes, you have to restrict your salt. For that's probably a good thing because people have edema, people are have swollen legs and so on. So you should avoid that. However, in normal people or even mild disease, it doesn't seem like there's any benefits. I mean, again, the whole idea, it makes very little sense, because if salt was really that bad for you, you could look at populations that eat very high salt diet. And the one population in the world that eats the most salt, like way more than everybody else, is Japan.
Yeah.
Japan also has some of the longest living people, in the world. So if salt was really that bad for you, if it was that much of a problem, well, then why are the Japanese people having so little problems health-wise? Maybe
True.
the salt isn't that big an issue overall. And I think that's the real answer. So in certain situations, very specific indications, you might want to restrict salt, end stage kidney disease, end stage heart disease, and this thing that you see in the American Black population, which is this very common to have this salt sensitive hypertension. Those people might need to avoid salt, but for most of the people, it's probably not a relevant issue.
Yeah. So even when I talk about salt, like when you go on low salt diet, your potassium is going to it's going to up, and a lot of other problems, because like even they have problems with indigestion, they can't digest their food, and even for fluid homeostasis you need you need sodium chloride. So even I think, like as you mentioned, the people who are having CKD stage 5 or renal failure, or that is the only or certain condition where we should restrict the sodium diet. But for the general population, those who are not salt sensitive, and for them it's restricting their sodium might not be a good idea.
Yeah, exactly. So yeah, it's one of these things that's really overblown, I think, in terms of how helpful it really is. It's very, very few situations where salt restrictions are going to be necessary.
Thank you, Jason. Thank you so much for your time, and it's really a great honor to have you, to talk to you, and to have your insight on low carb, high fat diet and intermittent fasting. So at the end of this session, what is your message for the people of Nepal, those who are diabetic or those who are metabolically ill?
I think the main message is that type 2 diabetes is largely a dietary disease. So really you have to fix the diet. And that is much more important than getting the right medications for it. So you really want to go back to sort of cutting out the processed foods, cutting out the refined foods, particularly the carbohydrates. If your body can't handle carbohydrates well, then don't eat them, right? It's not that difficult to understand. If those foods are spiking your blood glucose and your blood glucose is too high, then don't eat those foods, right? Not very difficult to understand. It's just common sense. And that's the most important message is that it's a dietary lifestyle disease. So fix that before you get to medications.
Thank you so much, Jason. Thank you so much.
Okay, thank
We'll,
you.
I'll see you soon.
Yeah.
Thank
Okay, thank you so much.
you.
Okay, bye.